Upstate Medical University in Syracuse, New York invites you to be the informed patient with the podcast that features experts from Central New York's only academic medical center. I'm your host, Amber Smith. Some 18 million Americans have diabetes. Many of those people are at risk for debilitating foot complications, which are largely preventable if you seek medical care promptly. I'm talking about that with Dr. Ricardo Lundi. He is a podiatrist and an assistant professor of medicine at Upstate's Joslin Diabetes Center. Welcome back to The Informed Patient, Dr. Lundi.
Thank you for having me back.
I understand that about 1 in 4 of the people with diabetes are undiagnosed. They don't know they have diabetes. But some of those common foot problems can be how a person learns they have diabetes. Is that right?
Yes, that is true.
So let's go over some of the foot problems you see on a daily basis. Let's start with calluses and corns. Can you explain what these are and how they develop?
Calluses and corns are skin changes. A callus you would see on the bottom of the foot, and that comes from pressure from how the person walks, not wearing proper shoe gear. Corns are usually on the top of the foot, the dorsal surface of the foot, the toes, and that comes from rubbing from within the shoe. So same thing, improper shoe gear can cause both of those things.
And I guess I want to make sure just because you have a callus or a corn doesn't mean you have diabetes. But if you are diabetic and you develop these calluses or corns, why is that a concern?
In a diabetic, a callus or a corn, which a lot of people have just from walking and wearing bad shoes, can cause ulcers. So the pressure from the corn, the skin will break down and create a diabetic foot ulcer. And those ulcers can get infected, and that can lead to things like amputations.
Well, if you catch this early, though, how is it treated?
Calluses and corns in the podiatry office, they're usually debrided, shaved down with a blade within the office. We will recommend people use things like different types of creams, foot creams like amlactin or urea. And at home, a patient can use a pumice stone on the callus to file it down so that it's not as prominent and so there's not as much pressure around the callus of the corn.
Now, you called this like an ulcer. What does it look like? Is it like a blister or does it have color to it?
Ulcers are skin breakdowns that are deeper than blisters, deeper than a callus. So the skin has broken and you're really looking past this normal skin level. An ulcer can look red if it's healthy, or there could be discoloration like yellow, fibrous, thickened tissue, but they're open wounds.
Okay. Now, what about athlete's foot? Why is that a potential problem?
For a diabetic, athlete's foot is a problem because the athlete's foot can lead to dry skin, cracked skin. They can also lead to blisters, and that can lead to a secondary bacterial infection where the person, same thing, where they have the bacterial infection, they can potentially lead to an amputation, but that's why we would be concerned for athlete's foot.
And you don't have to be an athlete to develop this, right? This is an infection that you can get on the skin of your feet?
Yeah, it's a fungal infection. So you can pick it up like at a locker room or sharing other people's shoes if they have athlete's foot. And because it's a fungus, it needs to be in a warm, wet area. And because we sweat in our shoes and it's nice and warm, usually they're able to grow. Once you develop athlete's foot, the main way to get rid of it would be to use an antifungal cream, sprays, antifungal orals to get rid of the fungal infection.
And hopefully people can do that with over-the-counter products at home?
Yes, for most athlete's foot, you can use an antifungal cream that you can get at the pharmacy. If you need something stronger, then you would get a prescription for a podiatrist or your family medicine doctor.
Now, speaking of fungal infections, what can you tell us about fungal nails?
The same group of fungus that causes athlete's foot can cause nail infections. So usually you see them together, but in the nail, the fungus can eventually cause permanent nail damage, which makes the nail thicken, yellow, greenish, and hard to cut. Those usually end up being a problem for diabetics because they're hard to cut. And so they're unable to cut their nails, or if they try to cut it themselves, they'll cut themselves and end up with a bacterial infection. And again, back to possible amputation.
Well, is that something a podiatrist deals with then, or can they go to a nail salon and have that dealt with, or do they need to see a podiatrist?
We usually recommend that they see a podiatrist, especially if they are diabetic and they have history of diabetic foot issues, neuropathy, and things like that. So yes, we would recommend that they go to a podiatrist.
This is Upstate's The Informed Patient podcast. I'm your host, Amber Smith. I'm talking with podiatrist Ricardo Lundi from Upstate's Joslin Diabetes Center about foot issues and diabetes. Now, many people develop bunions and hammer toes. Why is this a problem for someone with diabetes? And can you define what a bunion and a hammer toe is?
So bunion is a deformity along the big toe. Basically, the joint has shifted, so you can see the next bone after the big toe, and you can see a bump around it, and the big toe kind of shifts towards the second toe. And it becomes a problem because it makes it harder to find shoes. The person's foot is wider. They get with floor-fitting shoes, they can end up with blisters, wounds, and that can lead to infection. A hammer toe is a deformity of the other toes, the lesser toes, where the toes kind of form a claw-looking structure. The deformity is usually at the metatarsal joints, and those are issues because you'll get rubbing on the toe if the person's wearing an ill-fitting shoe, and that could lead to a wound. You can also get wounds at the tips of the toes, because the tips of the toes are now, like I said, in a claw-like position where they're taking pressure that they normally wouldn't take while walking, and that could, again, lead to infection and amputation.
Yeah, it sounds like it can be a painful kind of situation. But if someone has diabetes, there's a lot of over-the-counter products to try to relieve some of the pain from bunions and hammer toes. But if those aren't effective, someone with diabetes, are they a candidate for surgery?
They can be candidates for surgery. It's going to depend on other things, how well they heal, how under control their glucose level is at. So usually if it's 8 or higher, they're likely not going to be a candidate for surgery. If they've had healing issues, they may not be a candidate for surgery, but surgery is an option for someone with a bunion and hammer toes, even if they're diabetic.
Okay. What is Charcot foot? Charcot. What is that and how does it develop?
So Charcot foot is a deformity of the foot that you see in someone who has neuropathy. So technically anyone with neuropathy can get a Charcot foot, but we're concerned about diabetics. So you'll see it in a diabetic where they have neuropathy and they've have microtrauma to the foot. They fall, trip, injure the foot, and enough microtraumas can cause the foot to change shape. And so some people end up with like a rocker bottom shaped foot, and that shape can lead to formations of ulcers. And we would be concerned about that if they developed an ulcer.
Now, neuropathy, that's numbness and tingling in the feet or the lower legs.
The neuropathy happens everywhere. So someone can come in with neuropathy in their hands as well. But for podiatrists, would be looking at it in the foot. And it's nerve damage from high levels of glucose. The byproducts of the glucose end up settling on the nerves and eroding the tissue. And so people do end up with like tingling and stabbing and burning and numbness in their feet.
Do you ever see people with peripheral artery disease that affects their feet?
We do. It affects the healing. So if someone has peripheral artery disease and they end up with an ulcer, if they don't have the peripheral artery disease, treat it with like a stent or a bypass by a vascular surgeon, they could end up with slow healing wounds and eventually an infection. That would be something that would need to be treated, hopefully before they ended up with an ulcer. But if they did, we would have to check to make sure that they don't have it or they do have it.
It seems like there are a lot of issues for someone who has diabetes. Are they recommended to have regular appointments with a podiatrist just to make sure none of this starts developing without them noticing?
Yes, I tend to recommend that if someone doesn't have a lot of the diabetic complications yet, that they see us once a year. If they have had amputations or ulcers, we'll see them sooner. So like every 1 month to 3 months, sometimes 3 to 6 months, depending on their history.
I understand that when these foot problems are severe enough, and you've mentioned it several times, that a person could face amputation. So let me ask you for some advice about preventing amputation. We talked about regular visits to a podiatrist. Is there anything else that people can be doing on their own to prevent the complications from developing that might lead to something that needs amputation?
Yes. So, one, if they have any concerns about their feet, they should contact their podiatrist. They should be doing their own foot checks at home. They can look for corns and calluses and athlete's foot and ingrown nails and things like that on their own. They should be changing their shoes relatively frequent, so 6 to 12 months, depending on the use of the shoes, and other things like moisturizing and making sure that they don't develop cracks on their skin.
Does diet and sugar intake directly impact foot issues?
The glucose level, I would say, does impact foot issues. If you're developing neuropathy, you could potentially start to have foot issues. Your gait might change, and that could lead to things like calluses and corns. So, working with your endocrinologist to keep everything under control is a good idea. And if you have concerns about diet, seeing a dietitian would be a good idea as well.
Okay. Well, I want to ask you to please walk us through what a patient can expect when they come to see a podiatrist like yourself. But before we get into that, do all podiatrists care for patients with diabetes, or is there special training that's required to provide diabetes foot care?
I would say that all podiatrists are trained to take care of someone who has diabetes, but I think that there are practice preferences. So not all podiatrists will see diabetics. There is specialty training for people who want to deal with charcot foot, fellowships to do surgical corrections of charcot foot. So if the person's a candidate, we would try to send them to someone who specializes in that kind of repair. As far as what a patient can expect when they come into the podiatry office, we're going to talk to them about their medical history. We'll find out if they have neuropathy, if they've had history of ulcers, history of amputations. We'll look at their feet. We'll check for signs of athlete's foot and nail changes. We'll check their pulses. And my office, we're doing ABIs, which tests for peripheral artery disease on most of our patients who are over 50. We offer it as a test that can be done. We'll check for neuropathy using a monofilament or a tuning fork. And if they need more tests, we'll send them for things like EMGs to have their nerves tested. And we'll talk to them about how to take care of their feet. If they're candidates for diabetic shoes, we'll give them a prescription for diabetic shoes and then decide whether or not they're going to come once every 3 months or once a year.
Are people with diabetes recommended to get regular pedicures in between their visits to the podiatrist?
Usually, no. If they're coming to us for nail care, they're coming once every 3 months. If they need to be seen sooner, depending on their nail growth, we'll follow insurance rules and we'll see them once every 9 weeks, the soonest. But if they're one of our patients we're seeing once a year, they can technically get pedicures and cut their nails themselves. And they just have to be careful to look out for changes that might prevent them from being able to do that anymore.
All right. Well, thank you, Dr. Lundy. I appreciate you making time for this interview.
Thank you. Thank you.
My guest has been podiatrist Ricardo Lundi, who is an assistant professor of medicine at Upstate's Joslin Diabetes Center. The Informed Patient is a podcast covering health, science, and medicine, brought to you by Upstate Medical University in Syracuse, New York, and produced by Jim Howe, with sound engineering by Bill Brokel and graphic design by Dan Cameron. Find our archive of previous episodes at upstate.edu/informed. If you enjoyed this episode, please invite a friend to listen. You can also rate and review the Informed Patient podcast on Apple Podcasts, YouTube, or wherever you tune in. This is your host, Amber Smith, thanking you for listening.